Hello, my name is Tyla Morton. Today is the 10th of April 2016. Today I'll be taking blood from a horse. The horse is suitably restrained with a headstall and held by my restrainer. For the procedure I will be wearing gloves for PPE for personal protective reasons. I'll be using a vacutainer today to take my blood sample, as that is the safest way. Firstly, I will swab down the jugular vein where I'll be taking the blood for aseptic purposes. I'll be using two different sample bottles. First is the EDTA, which stops the blood from clotting. It's used for haematology analysis and is used to preserve red cell morphology. Once I have taken the sample, I will gently roll the bottle from side to side to ensure the EDTA is evenly distributed throughout the sample. I will then take the serum sample, which is taken in a plain tube and is used for biochemical analysis. I will start off by, I've put the needle onto the vacutainer. I will uncap the needle. I'll hold up the jugular vein on the horse and insert the needle. I will then insert the EDTA tube onto the vacutainer and it'll fill with blood. I will then unclip it, roll the bottle gently. I will then insert the plain tube, which will then fill till it's full. I will then take the plain tube off. I will then take the vacutainer out and the needle out of the vein. I'll hold pressure on the vein to reduce the risk of a hematoma. I will then dispose of the vacutainer and needle into the sharps container. Before the procedure, I labelled the bottles with all the horse's particulars, the date, the time and the clinic ID. Once I finish with the horse, I will package up the samples into a packaging container, which will then be sent off with the courier, along with the appropriate documentation of all the horse's details and the tests required to be done. The results of the blood test will go onto the horse's file on RxWorks, so the history will always be there. All the waste will be disposed of, the sharps in the sharps container and other waste in the general waste container. I will clean off the bench with AviSafe. I will then remove my gloves and wash my hands when I'm finished.